Good morning, everyone. I'm Dr. SURBHI AGRAWAL from Shankara Eye Hospital, Bangalore. I'll be talking to you today about an innovation that we did. We made a chandelier using discarded items which are available in the OR. So it all started when we decided to post a vitreous hemorrhage for surgery. We were expecting it to be a quick swim in the ocean like this, but when we encountered this, our expression quickly changed. So then the obvious question, we asked sister for a chandelier. But as usual, there's always a shortage of something, and that day chandelier was not available. Chandeliers are expensive, and usually only a few pieces are available in each OT. If some have been used before you, then you may not get one for your case. So we thought, what is the alternative to a chandelier? How can we create an alternate light source? So we thought if we could use a light pipe in some way, modify it some way, and use it as a chandelier. So we found a discarded chandelier that the sister had accidentally opened for the surgery. What we did, we tried to put it in the trocar, but it was not possible. So what we did is we removed the probe from the light pipe. After removing the probe, we removed the outer casing of the fiber optic, and the fiber optic was exposed. Now it was possible to place this fiber optic in the trocar and seal it with a sticker like we normally do for chandeliers. However, the next problem was this: an infinite amount of the fiber optic would enter the eye, and then it could cause retina touch. So we needed a stopper. So now how do we make a stopper? We wanted access to a material that was easily available in the OR, would be amenable to sterilization, or already available in a sterilized format. So then we got the idea of using a buckle. So we used a small piece of a silicone buckle. We made a hole in it using a 26 gauge needle and threaded the fiber optic through that. And here our DIY chandelier is ready. So this is another case where we made this. We used a 240 band in this case. We cut a small piece of the band, made a hole using a needle, threaded the fiber optic through the band, and placed it in the trocar. Here our DIY chandelier is ready. So just showing a few surgical videos. This is one of the cases where we used a DIY chandelier for inferior PVR. We can see that the surgeon has a forceps in one hand, a cutter in one hand, and is doing bimanual surgery. And in spite of the presence of a slight cataract or a lens opacity, the view is good, and surgeon is easily able to do the surgery. This is another case where bimanual surgery was done for a diabetic patient, forceps in one hand, scissor in one hand, and we can see that the area and intensity of the illumination is comparable to a standard chandelier. So our chandelier is placed and fixed in a cannula similar to standard instruments. The area and intensity of illumination is similar to the commercially available chandeliers. So what we did is we asked 3 independent vitreoretinal surgeons to use our chandelier and try it out. So ease of making, ease of insertion, and ease of removal, everybody rated it 1. However, the comfort and the ease of use improved as the number of cases of the surgeon increased. So as compared to the commercial chandeliers, which may cost 6,000 to 12,000 rupees per piece, our chandelier is absolutely free, as we make it from discarded items available in the OT. So since the fiber optic is thin, whether you make it with 23 or 25, you can still use it for both the trocars. And since the stopper is large, it can easily contain well in 23 and 25 gauge both. And because it is made from discarded items, there is a virtually unlimited supply available for emergency use in the OT. The disadvantage is that because of the rigid cable, there is limited mobility and limited globe rotation slightly. There is a theoretical risk of lens and retina touch by the protruding part of the fiber optic into the eye. However, we did not face this problem in any of the cases that we used the chandelier. And even though we are creating a second chandelier, there is a need for a light source. Of late, we have been trying to use it with the LED light source, which has actually 3 ports. So for us, need for a second light source is also avoided. So the take-home message is that creative thinking can be done to overcome a crisis situation, not just in terms of surgical technique, but in terms of surgical instrumentation also. And we are not looking to replace the gold standard here, which is the commercially available chandelier, in which thousands of dollars of research has gone, and they're perfectly designed to suit the need. However, we are offering a chance to adapt to adverse circumstances. Thank you so much.
Excellent. That was an excellent novel idea. Dr. Rashman sir, your comments please.
Yeah, so I think amazing. You just gave a message that every problem has a solution, and it looked great. Of course, I leave it to Dr. Chawla, Madam, or Dr. Anirudh for...
Yes, please.
Excellent idea.
Thank you, sir.
But normally when we discard light pipes, when they become ineffective after 2 or 3 uses, how come the light is good in a used light pipe?
So for
because
us,
we've discarded it. That's the only reservation I have. Otherwise, it's an excellent idea.
Thank you, sir. So for us, the main problem with the light pipes is that the probe tip becomes bent after multiple uses, especially as we have many fellows operating in the starting of the surgery, we tend to bend the probe. So the probe tip breakage is the main issue that we have. Yes, sir. So the breakage doesn't affect us in this case.
Breakage is mostly at the tip.
Yes, sir.
Thanks.
It's good. Only thing is that the stopper has to be really tightly fixed. Otherwise, the light pipe will slide inside and touch the other side of the retina. So that has to be extremely
So,
tight.
ma'am, we did not have that problem, but can we go back to my presentation, please? We have tried another thing. So what we even though we did not have this problem, we envisaged that this could be a problem. So there are two things that can be done for that. One, what we have done is we tried to use two pieces of buckle. So we've actually created a double stopper there. So what happens is it increases the resistance and the chances are further decreased. The other thing that we can do is probably use cyanoacrylate glue. We have not done it because we did not feel the need. But cyanoacrylate glue is usually easily available in OTs because anterior segment surgeons are using it for corneal ulcers. And it is already tested. It is medical grade and it is resistant to sterilization like ethylene oxide or autoclave. So that's an effective thing that we can use to hold the stopper in
Just use an
place.
adhesive on both sides so that it doesn't stick.
Yes, sir. Cyanoacrylate is the adhesive we
is
can
like
use.
Plaster also.
Yeah, it is
Yes,
good.
sir.
Use the tape which
But you know, I mean,
comes
you have
with
to
a sheet.
use-
Yes,
multiple
sir.
things would have to be
Sticker.
used because any one thing would give way.
Yes.
These things somehow have a way of sliding in.
Ma'am, we did not have that problem, so we did not use,
Yeah.
but we envisaged the questions, so we
Yeah.
came up with these.
Okay, that was a nice one. Dr. Shruti?
So how much of that
Please.
fiber would you cut?
So we've kept 5 mm anterior to the buckle because we are using the goiter chandelier system currently, and the chandelier tip beyond the stopper in goiter is 5 mm, so that is the length we are also
No, but
using.
in all, how much of the fiber you have cut? So that
So,
like, if it slides, how much can it go in?
So that is a two-pronged thing. So one thing is if you cut lesser fiber, the chances of going in are less, but if you keep more of the black tubing, it increases rigidity, so your globe rotation becomes a problem. And if you see in the chandelier system also, so more of the fiber optic is there. So that it is a two-pronged thing.